How do we best translate and manage the biomarker experiences and the personalized medicine that initially started out in academic centers into the community remains a challenge of some sort. But there are examples where this has been going really well, and we now start understanding also some of the barriers and what causes that. The ease of a test is very important, that this can be rapidly circulated and implanted in many different locations. But it's also the readout of the test. There's different flavors that we have in oncology. We have very binary readouts, so it's yes or no. So doctors are very easy to deal with those. And then there's more complicated, where it's 50% of that and 60% of that combined with 20% of that, which makes for a much more difficult treatment decision at the end of the day. So education is absolutely key to focus on really the key elements and give doctors tools to interpret the tests that are done. In addition, when we now talk about novel biomarkers and bringing them forward into development, we also have to realize there are regulatory issues that we have to deal with. The guidance from FDA at this point is not very clear. It's based on a few examples that I personally happen to believe are not necessarily the way they all will go down in history, because there are bias in certain extent. So we have a lot of work to get this right, and there's a lot of opportunities. But education is clearly key. Education, but not only on the doctors, but also on the patient side. And here we see a lot of progress made by various patient advocacies that make it their business to educate the patients alike. So when they talk to their doctors, they come prepared with questions and have a meaningful conversation. Barriers for the development of biomarkers and their translation into personalized medicines have a lot of different angles to be looked at from. Starting with a business proposal, a biomarker without a drug, without a clinical trial and data is just a biomarker, and therefore to develop that into a full-fledged diagnostic test proposes a certain financial risk that people like to measure out as they engage in the development, because it is a chicken-egg situation. I have a biomarker, I might have a drug, but who tells me that this drug with this biomarker in combination will be successful? So there is this challenge, and our position at Plexxikon is, and we communicated this to the FDA, is we propose a really staged approach that one meter out resources and funding as the project matures, as risks are removed, so that at the end, this is from a financial perspective and risk management perspective, a viable approach. That you don't have to plug down $30, $40 million in an investment, 2 years later find out that was really not worth it. So there's a lot of dialogue going on, and again, there is not one shoe fits all perspective, but overall we think there is an institution in the US that is somewhat underutilized, and these are the CLIA-certified labs, which really do not fall under the jurisdiction of the FDA, but have all the expertise and the talent, and already are distributed throughout the country. So from a distribution perspective, you would actually get much faster penetration into the community if one would go that route of involving CLIA-certified labs in developing of these biomarker assays and selecting patients for clinical trials. But this is still a subject of discussion with the FDA, and they're working on guidance.